So many patients ask me questions about dry eye, and a lot of it is based off of misinformation that they have read on the internet. So today I want to talk to you about the 5 myths, or the 5 dry eye lies, as I like to call them, that patients have often come to me with, and I just want to correct those myths for you. So let's get into it. Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist and I practice in the state of Maryland, and you're watching the eyefacts.com channel. So let's get into the 5 biggest myths about dry eye. So myth number 5, any dry eye drop is fine. Now, unfortunately, there are a wide variety of dry eye drops, and some are way better than others. Now, if you have really mild dry eye and it doesn't really bother you and you don't really notice it, yeah, for you, any dry eye drop may be fine. But if you're someone who's putting in your dry eye drops 4 or 5 times a day, you really need to be using preservative-free eye drops, because the eye drops that come in the large bottle that are the regular eye drops will have preservatives in them, and the preservatives can actually start to bother your eyes if you are using them more than 4 times a day. So not all dry eye drops are created equal. When you are choosing something for dry eye, my recommendation is always to use preservative-free, and especially if you're a contact lens wearer, use preservative-free drops. Number 4, dry eyes can be treated by drinking more water. So unfortunately, how well hydrated your body is has not that much to do with dry eye. It is important to be hydrated just for your general health, and obviously being dehydrated is not a good idea. But certainly overhydrating is not going to help your dry eye that much. It's just maintaining a normal amount of hydration just for your general body's health is what's recommended. Dry eye causes are typically from things like inflammation or meibomian gland disease, and unfortunately just hydration is not going to solve this. Myth number 3 about dry eye is when my patient says to me, "But doctor, my eyes are watering all the time, they cannot be dry." So interestingly enough, watery eyes is another sign of dry eye, and this is because when the eye is dry, it sends a signal to the brain and it says, "Hey brain, I'm dry," and then the brain sends a signal back to the eye where the gland is and tells the gland, "Hey, the eye is dry, can you make more tears?" So then the gland starts pumping out tears, but these are actually not very high quality tears. So the eye is watering, but it's not actually getting appropriately lubricated, so it doesn't really solve your problem of dry eye. So if you have watery eyes, you still may need dry eye treatment. Myth number 2, dry eye is no big deal, it'll just go away on its own. Now, unfortunately, it is very unlikely that dry eye will just go away on its own, and in fact, as we get older, dry eye tends to get worse with age. The other thing is that for some people, dry eye is really miserable, and it can actually cause serious vision changes. It can also cause pain, light sensitivity, difficulty driving. So depending on how bad your dry eye is, it can actually really affect you on a day-to-day basis. And I've actually seen patients where their vision has gone 2 lines better just by treating their dry eye, because we couldn't figure out why they weren't seeing well in terms of their prescription was totally right. They did not have any problems in their retina, no glaucoma, and literally just treating their dry eye really improved their vision. And it was just a dramatic improvement. So I have seen this myself, that dry eye can be a really big deal for patients, and unfortunately it's not just going to go away on its own, so it should be treated. And now myth number 1 that I want to correct is that there's only artificial tears available. So I've had a lot of patients who are like, "Yeah, but I take artificial tears and that's all I can do," right? So actually there's a ton of dry eye treatment available, from artificial tears that you can get over the counter to also treating your eyelids, because your eyelids have a lot to do with dry eye and making sure your eyelids are healthy. So you want to make sure that you treat any meibomian gland disease. There's another video on the channel about that. So you can look into that, about how to properly treat your eyelids and your eyelid glands. And also there's in-office procedures that we can do. Some are covered by insurance, some are not, but there are more advanced therapies. So it's important to know that artificial tears are not the only thing that are out there, but in-office treatments like punctal plugs are very effective. You can also get something done called IPL, which some people find very helpful. There's also prescription eye drops, which can be very helpful as well for patients. So although drinking extra water is not going to help your dry eye, certainly using some of these other methods of treatment can be very helpful. If you have a question about dry eye, be sure to drop it in the comments and I'll do my best to respond or make another video about your question. Please support the channel by subscribing. It really helps me out, and thanks for watching.